Your health is your responsibility. I'm sure you've heard that phrase time and time again. Well, in today's Jamaica Magazine, you'll hear it yet again because your health is on the agenda. In fact, it's the focus of today's show. October is celebrated annually as Breast Cancer Month. So coming up, we zone in on how a proper diet can safeguard against diseases such as cancer. And later, the importance of exercise and overcoming drug addiction. Stay right there. An informative show awaits you right after this break.
Good day, I'm Sandra Johnson and this is your GIS News for Friday, October 2. The Ministry of Health and Wellness has signed a $3.6 million cooperation agreement with the United States Center for Disease Control and Prevention CDC to support strategies for Jamaica's national HIV response. The document was signed on Thursday by the State Minister of Health and Wellness, the U.S. Ambassador to Jamaica, and the Director of the CDC Caribbean Regional Office. The strengthened access to and delivery of quality public health services for prevention, care, and treatment of HIV, STIs, addressing diseases of public health importance, and advancing global health security in Jamaica under the President's Emergency Plan for AIDS Relief, PEPFAR, is a 5-year agreement. The State Minister of Health and Wellness says one of the unintended consequences of the COVID-19 pandemic is that manageable chronic diseases such as HIV have received less attention and disruption in treatment and care. She says the activities under this cooperation agreement will allow Jamaica to refocus and reprioritize key actions that will help the country meet the UNAIDS 1990 targets.
For the first year of the agreement, some of these priority actions will include development of the digital HIV/AIDS confidential reporting form and validation of the data, which indicates that 90% of all people living with HIV know their HIV status. These will be carried out under the strategic information component of the project.
Other interventions under the project will include revising the Peer Navigation Training Manual, developing an orientation manual and toolkit for prevention staff, utilizing social media as an outreach tool to create linkage to testing and prevention. HIV diagnostic services will also be improved with the employment of additional staff at the National Public Health Lab, and a backup machine for viral load testing will be procured. In other health news, Portfolio Minister Dr. Christopher Tufton is calling on operators of care homes to follow the health and safety protocols implemented by the government to minimize the spread of COVID-19 among their vulnerable residents. He made the call during an inspection of health and safety protocols at the Golden Age Home in St. Andrew on Monday. Minister Tufton says that with the country now at the phase of community spread, care home operators must observe the established COVID-19 protocols because the impact on these institutions can be devastating.
I want to use the opportunity to encourage the other similar institutions across the country. The response to COVID right now is going to be heavily dependent on all of us playing a role. It's going to be heavily dependent on the protocols that we establish for work, for leisure, for industry of one form or another, and in this instance for a home for the aged being observed.
Dr. Tufton says the ministry has been working with the Kingston and St. Andrew Municipal Corporation, KSAMC, and the management teams of the respective agencies to ensure the safety of residents in other such facilities. The Ministry of Agriculture and Fisheries has allocated $80 million to the Jamaica Agricultural Commodities Regulatory Authority, JACRA, to assist coffee farmers affected by the COVID-19 pandemic. Minister Floyd Green made the announcement in a meeting with the Jamaica Coffee Exporters Association, JCEA, on Wednesday. He said the support would include extension services and input supplies such as fertilizers and chemicals. Minister Green added that the ministry was going through the procurement process and expected farmers to start receiving the inputs within another few weeks. Jamaicans could soon be seeing a simplified authentication process of local documents intended for use overseas and for the recognition of foreign documents intended for use in Jamaica. This after Justice Minister Delroy Chuck introduced the Authentication Foreign Public Documents Bill 2020 to Parliament on Tuesday. Under the bill, certain local documents can be authenticated in international countries. These include birth, marriage and death certificates, decrees for the dissolution of marriages, excerpts from official public records and registrars, and medical and health certificates. Currently, some documents needed for use overseas require verification through a process known as authentication or legalization before they are accepted for use. If the recipient in the foreign country is not familiar with the identity of the signee, the seal or stamp on the document, there is a need for legalization.
Persons in other countries do not recognize, they might not appreciate what our birth certificate, our marriage certificate, various documents. And once a person gets it legitimized by a apostille certificate, the other countries accept them easily without the other countries having to go through, or the person having to go through a process of legalization.
The minister says the bill will also support Jamaica's implementation of the Hague Convention abolishing the requirement for legalization of foreign public documents, commonly known as the Apostille Convention. Online filing is now mandatory for all taxpayers submitting returns for Guest Accommodation Room Tax, GART, using the RTO1 form. This came into effect on October 1 and must be done via the Tax Administration Jamaica TAJ online portal at jamaicatax.gov.jm. The TAJ says this marks the latest step in a phased introduction of mandatory e-filing, which began in 2014. GART applies to hotels, bed and breakfast operators, villas, apartments, motels, guest houses, resort cottages, and timeshare operators. GART returns are due on or before the last day of the month following the reporting period. The National Baptist Basic School in Kingston has received well-needed equipment and items to assist with managing the COVID-19 pandemic. On Tuesday, the 3 awardees of the First Heritage Cooperative Credit Union Civil Servants of the Year Awards for 2019 handed over a donation of a desktop computer, printer, and educational items. The initiative is part of the awardees' community outreach project and was matched by the donation of hand sanitizers and money for desks and chairs they helped secure from other sponsors. There were also gift items from the Administrator General's Department, as well as educational charts and booklets for the children to read from the Jamaica Information Service.
But I must observe everybody who took time out, especially in this time of a pandemic, to really think about us. But today I am humbled when persons can take time out, especially in this strange time we're living in. Because I know it has affected everybody in one way or the other.
And finally, a dedicated email address and hotline numbers were launched by the Ministry of Education today to provide additional support for parents and teachers making back-to-school preparations.
2 national numbers have been created. 888 Educate. So that's 888 338 2283 or 888 SCH time. So that's 888 724 8463. Parents, teachers, if you have questions, you need to find out where to go, what to do, please call those numbers.
Back-to-school queries can also be sent via email to educate@educate.gov.jm. And that's it for GIS News today. I'm Sandra Johnson. Thanks for watching.
According to numerous research reports, certain food items and nutrients may help prevent or contribute to certain types of cancer. To learn more about these findings, watch our next feature.
We must exercise. We must seek to eat the right portions of the food groups that these studies have shown are important to a healthy body. And healthcare in Jamaica, I think, needs to shift somewhat away from the challenges of curing ailments to the challenge of preventing.
And as Jamaica moves to balance its disease prevention interventions with the curative aspects of healthcare, Jamaicans must explore the role that the foods we eat can play. Nutrition does play a role, both as a risk factor and as a tool for managing diseases such as cancer.
Essentially, cancer occurs whenever one of the cells in the body decides that it's going to misbehave and not listen to any instructions at all. And so it just grows and grows and grows and doesn't listen to the regular body signals to say, this is how you should behave. So it's really a misbehaving cell which proliferates and grows and it then becomes a misbehaving tissue.
And what you eat or not can make a difference in how your body's cells behave.
The fundamental control systems in your body are all chemicals. And therefore, the chemicals that you put in your body comes from food. So if there is any mismatch or which can occur, one can end up with having what we call a risk of cancer.
Doctors say that a typical diet for most Jamaicans, with its huge servings of starchy foods like rice, flour, yam and banana, with only small amounts of vegetables, does not provide the healthy benefits that can come through a diet. Instead, doctors suggest eating more fruits and vegetables rich in fiber and antioxidants, and fresh foods high in calcium and vitamin D. Fat-related chemicals are among those that tend to promote cancer, so diets that are high in fat create more of a predisposition to the disease. Alcohol can also have a negative impact.
We say you should not smoke. We also say that you should not consume alcohol if at all possible. The equivalent of an ounce a day is perhaps the limit that we'd allow.
Of course, there are other things not in our foods, found in our environment, which can cause you to get cancers, including toxins such as asbestos. But our focus here is on the role of what we consume, particularly processed foods, which doctors agree should only be eaten in minimal amounts. Some processed meats, for instance, have been linked to things like the propensity to develop colon cancer. To lower the risks, nutritionists recommend fresh meats that are broiled, baked, or steamed to get rid of the excess fat. Nutrition is seen not only as a means of prevention, but also part of the treatment for diseases such as cancer. Patients with cancer are often given specific nutrition interventions as part of their treatment regimen.
So apart from the specific surgical procedure you may have, or the radiological procedure that you may have, radiotherapy, or even the chemotherapy that you may have, nutrition also plays a role in you surviving your therapy.
In striving for a healthy lifestyle, which includes eating well, it's important to maintain physical and mental fitness. Fit individuals engaging in physical exercise at least 3 times per week are more likely not to have any of the chronic, non-communicable diseases such as cancer.
You should engage in at least 3 bouts of physical activity, at least 30 minutes for the day, moderate walking at minimum or the equivalent. You should have to be as stress-free as possible, and you should aim to achieve your ideal body weight. So those factors would generally lead you to what we consider to be a healthy lifestyle, which will tend to protect you not only from cancers, but also other cardiovascular diseases like diabetes and hypertension.
Disease prevention should be our priority. So let's all make our food our medicine and our medicine our food. It's everybody's business.
So by now you should all know the benefits of regular exercise are numerous. In addition to lowering the risk of some conditions, such as obesity and diabetes, it can also improve fitness and muscle tone. Learn more next.
You want this lean, muscular physique and well-toned body, framed for the beach, carnival parade, or just your regular dressed down or formal attire. You want to cut the fat and develop that noticeable defined muscle and shape, but not significant muscle size. There's nothing wrong with any of that, as long as you remember the most important thing is not a summer or designer body, but rather a healthy body. By doing efficient exercises and controlling your weight, you can expect to safely lose between 1 and 2 pounds a week on your journey to a more fit body. But doctors recommend that you should not lose more than 1 to 2 pounds per week. For many people, even this rate may be too aggressive in terms of dietary and exercise modifications.
That body is not just going to come overnight. It's not going to come within 2 weeks or a month, depending. It all depends on the type of activity you do, how you do it.
Within 2 months, if you stick to your exercise program and if it's done properly, you will see and feel results. Before starting any structured exercise program, however, persons should first consult with their doctor.
The reason why we need a medical approval from our doctor is that a lot of us have pre-existing health conditions, and some of us are not as fit as we think. For example, in Jamaica, 4 in 10 is hypertensive and they don't know it. And it's the same with diabetes, 4 in 10 and don't know it. And our stats tell us 7 out of 10 Jamaicans die from a chronic disease. We define physical activity by intensity level and the frequency in which we do it. Frequency meaning how often we do it per week. For example, 2 times per week or 5 days per week. The intensity is the energy in which we use to perform the activity, meaning how hard you work out. There's 3 levels of intensity: low, moderate, and vigorous.
If you want to lose weight, the Ministry of Health recommends 60 minutes of moderate to vigorous exercise 5 days per week. To lose and maintain weight, 90 minutes of moderate to vigorous exercise 5 days per week is recommended. There are 2 main categories of exercise, namely aerobic and anaerobic exercise.
What this is saying that the body needs oxygen to break down fat that is stored in the body. All the calories stored in the body as fat need oxygen to break it down, that is in the tissue. So if you want to lose weight, you must do the aerobic activity to burn that fat that we use as energy when we're doing the activity. So the type of activities are like swimming, running, dancing. It is normally done for a long period of time.
When you decide to lose weight, you want results. Results keep you motivated and on track. Cardiovascular exercises are part of the aerobic category, and they help you trim down by burning extra calories. While this helps shed excess fat and strengthens your cardiorespiratory system, it won't build the tone in your muscles that you're after.
Now, when we talk about anaerobic activity, it is activity that does not need oxygen. It's quick, it's fast, it's snap. So most of the time, that activity will help to tone the muscles that we're looking for. But you cannot tone unless, we lose that fat. So you need to do the aerobic activity, then you do the anaerobic activity, which is like the weightlifting, the squats, the push-ups, the jumping, so that now you lose with aerobic and then you tone with anaerobic.
Calories are the name of the game when you're trying to lose weight. Eat fewer calories than you burn and the scale will respond.
Generally, we work with a 2,000 to 2,500 caloric intake per day for the general population. But for each person, their caloric requirements is different because we calculate it based on your specific age, your height, weight, gender, and how physically active you are. Females generally eat less because they carry less muscle mass than men, and so they weigh less. The range is different. For someone who is very slim and short, then maybe 1800 would be a safe amount to save for that person. But for men, 2100 would be the lower end of the spectrum.
You may create a caloric deficit, which will cause you to lose weight, but it's best to work with a balanced diet and exercise.
A caloric deficit is when you consume less calories than what you're using for the day. So usually persons try to cut their caloric intake significantly to lose a lot of weight at once, but consuming less than, say, 1200 calories per day can cause you to have nutritional deficiencies. You can lose muscle and bone, and your body will also go into starvation mode so that you'll stop losing weight altogether.
That's a no-no. The best way to slim down and tone up is to combine balanced diet and exercise. And avoid fad diets such as low-carb, high-protein, or anything that deviates from a balanced diet.
In Jamaica, we have food-based dietary guidelines that are specific to the Jamaican population, but it's based on the 6 food groups in the Caribbean. So we have food from animals, staples, legumes and nuts, fruits, vegetables, and fats and oils.
Losing weight at a rate faster than 1 to 2 pounds per week and regularly skipping meals can leave you feeling extraordinarily hungry so that you binge at the next opportunity, causing weight regain. Plan for 3 balanced meals per day, in addition to 1 or 2 healthy snacks.
You want to include foods from all of your food groups. So say, for example, you're planning for lunch, you want to include either food from animals or a plant-based protein like beans or nuts. You have your staple foods like rice, bread or pasta, your fruits and vegetables that you can include in a salad, and you can put your fats and oils, for example, like in pear or avocado. Healthy snacks are low in fat, low in salt and low in sugar. So you can have a fruit or vegetables, for example, carrot sticks, or you can use dried fruits and nuts. As a general guide, 1 serving of food from animals is the palm of your hand, a cup of rice is like your fist, and fats and oils is your thumb. That's 1 serving.
Losing fat and retaining or building muscle creates a strong, toned appearance. Do strength training activities that focus on all the major muscles and the entire body, upper, mid, and lower body. Plank is a good full body workout which helps to build strength in your core, upper and lower body. Those that focus on the lower body include lunges, using the stairs, leg press and squat exercises that effectively work most of the major muscle groups of the butt, hips and thighs. Some examples of exercises to strengthen the mid-body abdominal muscles include the side twist, traditional crunch, bicycle crunch and exercise ball. You can also try other activities to sculpt your legs, tone your thighs and bottom muscles, waist and abs.
Ensure that you hydrate properly. It is good to drink water before, during and after your activity so you don't get dehydrated. Don't wait until you're thirsty, just take your water with you and sip, little sip as you go along. So make sure you work out at an intensity level that suits you, because every one of us are at a different fitness level.
Getting and staying fit is a lifestyle change, so you have to make exercise a part of your daily routine and eat a balanced diet daily for a happier, healthier you.
Unfortunately, COVID-19 is still among us, and the number of confirmed cases are rising exponentially. This reality may cause many of us to become worried and stressed, so much so that we may resort to using drugs to curb our anxiety. If this applies to you, be strong. We have prepared a list of helpful tips that you can use to improve your mental health.
Generally across the world, it is accepted that persons with substance use disorders and people who are chronic users, problematic users of various substances, particularly smoking. So you're smoking cigarettes, you're smoking ganja, you're vaping, and then also alcohol use puts you at a unique risk for developing the complications that are associated with COVID.
The novel coronavirus that causes COVID-19 is notorious for attacking the human lungs. It's no wonder then that among the most vulnerable are people with compromised lung function or lung disease as a result of chronic smoking and alcohol abuse. The National Council on Drug Abuse is now more than ever urging Jamaicans to reduce and avoid excessive smoking and alcohol use. Though persons may feel the need to resort to substance abuse during the COVID-19 outbreak due to stress, worry, and fear, this can be a detrimental move. Rather than relieving stress and worry, substance abuse will weaken the immune system, damage the liver and lungs, and put persons at greater risk for suffering the worst symptoms associated with COVID-19 and other life-threatening illnesses. Additionally, the behavioral practice of smoking also poses added risks. If a person's hands are contaminated, then putting a cigarette, spliff, or vaping device at their mouth will cause them to easily become infected with COVID-19. To reduce drug abuse among chronic users, the National Council on Drug Abuse has proposed a few coping mechanisms. Contact your relatives, friends, and ex-addicts if you are struggling with chronic drug abuse. They may not be able to physically be there with you, but a call can give you the encouragement you need. Having a healthy immune system is important to survive this and any other virus, so ensure you eat well and engage in regular exercise to boost your immune system. Some parents are experiencing additional stress by having to supervise their children at home during this time. Structure can make you more productive and lessen chaos. It can also be beneficial to ask your children to help create the schedule. Make time for alone time. Ask other family members in the home to supervise the children while you do something for yourself. Use the time to better yourself, create new habits, focus on what you need to learn, grow, and give. Spend time pinpointing the things that are making you stressed and prone to abusing drugs. Try to address them one step at a time and find ways to distract yourself when these triggers appear. The National Council on Drug Abuse is now offering telecounseling throughout the island. For the Eastern Office, persons can call 876-926-9002 or 876-469-2521 for the Central Office and 876-940-2240 for the Western Office. Persons can also contact the General Helpline at 876-564-HELP. That's 876-564-4357.
Unfortunately, this is all the time we have for today's Jamaica Magazine. But no worries, another program awaits you tomorrow and every day after. Same time, same station. While you wait, why not re-watch today's show on our website, jis.gov.jm, or our YouTube channel. And don't you dare miss out on the opportunity to follow us on all the major social media sites for the latest information on government programs and initiatives. I'm Audrey. Until next time, stay active, stay engaged, and stay strong. Remember, your health is your responsibility.
This has been a production of the Jamaica Information Service, the voice of Jamaica.